Welcome to Bat Therapy, mental health through the lens of comics and film. Be a fly on the wall or a bat in the cave, listening in on a friendship built out of a love for talking Batman, comics, and the everyday struggle to achieve mental health and happiness.
We're your hosts, clinical psychologist Dr. Amelia Brown and educator and comic aficionado Keaton Hopkins. Don't forget to follow us on YouTube and social media and find our Patreon at patreon.com/battherapy.
This podcast is about providing education and understanding and is not a replacement for mental health treatment or support. If you're needing help, go to bat-therapy.com for resources.
All right. Shifting over to DC.
Okay. All right. Questions for a therapist about DC. Let's do it.
Dr. Harleen Quinzel, fellow coworker.
Yes.
How do you go about reporting that there's something inappropriate going on
Yeah. So
between her and one of her patients?
Yeah. So there are ethics boards. So you would definitely want to report to your system and structure the place that this is happening in. There's also the licensing boards and essentially going through the ethics reporting system for that person's discipline. And I've actually had scenarios where I've recommended to people, I think you need to report this situation. One of the tricky things is with I think any system, with any group, it's hard to report someone from your own team. You don't want to assume something. You don't want to overstep. You probably don't necessarily know what's going on. And actually, when it comes to the Joker, nothing's normal. So people might not have caught on for a while because it's like nothing's normal with the Joker. So, everyone's off their game. And so you would probably, it would be helpful to like warn that person and touch base and keep an eye. But yeah, it definitely reached a point. And especially there's also at Arkham, I would definitely suggest. So all of these systems have a way to show who's been in people's charts. And that would be something that Arkham, especially with the Joker and other infamous folks, they would, if I were in charge there, I would be doing regular reviews to see who's been going into the charts. So like, for example, when famous people have gone to the hospitals, people have been fired because they can't help themselves and they go into the chart and look at what's going on. So I think you would just have to keep an eye on those things for these folks and have review. So like have review of each other's information and consultation stuff to try and prevent this sort of thing from happening. But yeah, she would definitely need to lose her license.
Well, and Arkham's such a corrupt system as well, because who are you going to report it to? Hugo Strange, right?
Yeah. Well, and that's another tricky thing is that if you're in a corrupt system, corruption becomes the norm, and then you become used to it. And then you talk yourself out of, well, that this doesn't really need to be reported, or it's really not that big of a thing. And so the fact that this is a corrupt institution in most of the descriptions of it, that would actually just how we psychologically look at things. It would make it, someone from the outside would go, oh dear God. But when you're in it, what the baseline is for what goes on is just so completely different.
Thanks for nerding out with us. I'm clinical psychologist Dr. Amelia Brown.
And I'm educator and comic aficionado Keaton Hopkins. Check out my TV and movie reviews on YouTube at Team JBS. Check out our website at bat-therapy.com, our Bat Therapy YouTube channel, and follow us on social media. And don't forget our Patreon page at patreon.com/battherapy. See you next week. Same bat time, same bat channel.